And so today I have two guests to introduce. I'm delighted to invite today's speaker, John Paul CATUNGAL. John Paul is an assistant professor in critical race and ethnic studies at the Institute for Gender, Race, Sexuality and Social Justice at the University of British Columbia. His research interests include Filipinx and Asian Canadian studies, feminist and queer of color critique, and migrant, anti-racist and queer community organizing. Supporting John Paul today on the question and answer is Julia Chai. Julia is a first-generation immigrant and settler on the traditional, ancestral and unceded territories for the Musqueam people. As a recently graduated UBC alumni, Julia is currently a first-year medical student at the University of Calgary and has been actively involved in student advocacy and representation over the past 4 years. And today, John Paul will discuss race thinking in as health, Canada's historical geographies for and beyond COVID-19. And John Paul, I invite you to take over the screen.
Just want to confirm that what you're seeing is the first slide there.
That's correct.
Perfect, thank you. Thank you very much everyone for spending part of your Monday afternoon with me today. It is really an honor and a pleasure to be delivering this lecture as part of the 1 Hour at UBC series. We are gathering today in the context of intensified and publicly visible conversations, debates, disagreements that surface the importance of race and racism as atmospheric conditions, as conditions of daily life for many people, Indigenous, Black, and people of color communities. The rise of anti-Asian racism in light of COVID-19, as well as the intensified but by no means new activisms on Black Lives Matter and the carceral state. These are, as I mentioned, not new contexts, but ones that are lived in daily life and ones that are baked into the various structures of our society. And in many ways, the activisms that we are seeing very publicly today, while not new, are calling into question the taken for grantedness and of structures of society that are premised on really white supremacist forms of thinking. And so part of what I want to do today is to think through how race thinking as health, particularly in the context of Canada's historical geographies, are key to how we might understand more recent moments. I dedicate this lecture to the C19 Response Coalition. It's a coalition that I've been working with since April of local Greater Vancouver-based Chinese, Vietnamese, and Filipinx community leaders and organizers who in many ways are filling in the gaps that abandon the needs and leadership and issues faced especially by Asian communities in terms of the response to COVID-19. So I want to recognize them. Our website is c19health.ca. What I want us to do today is to think historically about health as an important technology of nation building, and one that ensconces racial thinking, race thinking, as a key plank of its function. And there are three things that I want to point to that hopefully allow us to think about the connections between race, health, and nation building. The first is that health supplies vocabularies and spatial imaginaries through which ideas around contagion, risk, get to be located elsewhere in the bodies and spaces of those who are foreign. And it is through this construction of foreignness, of threat and contagion that ideas around national vitality come to be guarded, right? Policies and practices that have been enacted in the name of the well-being of the nation are partly premised on ideas around racial categorization and boundary making in and through health. The second has to do with the nation state's own capacity to make these categories and boundaries do work through policies and practices that include ones that deal with health. These kinds of health policies and practices enacted by the nation state and other forms of settler colonial states give form, force, and materiality to racial ideas. So they are not just ideas that that take place in people's heads once they become the underpinning kind of logic of policies and practices. They come to have material effects on the ground, and particularly on the folks that they target. And then the third has to do with the power of both race and health discourse and how they acquire this power through the ways that they are often understood as and taken for granted as true, as natural, as just the way things are. I hope that in paying attention to these dynamics, part of what we can do is to think about what lessons thinking historically about the making of Canada as a nation can offer for us in terms of understanding the racial politics of our time during COVID. It would be remiss for me to do a talk on race and nation building without properly acknowledging the fact that I am joining you from the traditional, ancestral, and unceded territories of the Halkamenim-speaking Musqueam people, where my institution, UBC, is located. I live more broadly in overlapping unceded territories of Coast Salish peoples, including the Squamish and Tsleil-Waututh as well. And many of you in so-called Greater Vancouver would be joining us also from categories or from territories that overlap, ones that have been traditionally, ancestrally, and unceded lands, also the Coquitlam, the Kwantlen, the Semiahmoo, the Katsi, the Stoli Nations, and others. And I invite those of you who are joining us from elsewhere to also think about territory and land and your relationship to it as we go about and continue this talk. It is crucial for me to begin with an acknowledgement of territory, partly because as I occupy the space of privilege and responsibility delivering this lecture, I am constantly aware that I am here in so-called Canada as a migrant, as a first-generation migrant of Filipinx descent. And I am reminded by the work of Shireen Razak, Melinda Smith, and Sunira Tabani, who asked the question, how can we theorize our place when the place itself is stolen? Right? The things that I hope to be talking to you today are ones that are underpinned by this foundational violence, the settler colonial violence that is foundational to Canadian nation building. In terms of COVID-19, Indigenous communities have also been bearing the brunt in terms of health of the settler colonial and anti-Indigenous violence that permeates health discourse, health institutions, and the provision of care. We see that in terms of the ways that provision and access are very much unevenly distributed and inaccessible to many Indigenous communities. We see that in the ways that the effects on Indigenous people's minds and bodies of the intensified kinds of racisms, of care and non-care abandonment. And we see that in terms of the ways that cultures of care get to be take on very much the kind of anti-Indigenous settler colonial violence in the way that it adjudicates who deserves care and who doesn't deserve care, which is to say, who can be abandoned. The settler colonial logics are key for us to think about here. How did I come to this topic? I came to this topic of health as racial politics, certainly in the time of COVID, partly through some of the activisms that I have been doing in the community, premised on my own embeddedness and lived experience as a member of the local Filipinx Canadian community. In April, in partnership with RJ Aquino, I co-wrote an open letter calling on the provincial government to collect race data when it comes to COVID-19 as a way for us to think about and dislodge this idea that COVID does not discriminate. Right? We were one of several groups and racialized communities that called for such data, partly because we know from our own experiences, but also from what we've learned from other jurisdictions where such data is available, that folks of color, Black folks, immigrant communities, Indigenous communities bear the brunt of disproportionate deaths and other kinds of impacts in terms of COVID-19. And more broadly, public and official responses to COVID-19, I've noticed can and do entrench open, unquestioned racial ideas about who is risky and whose behaviors come to be figured as threatening the broader vitality of the community. And so we've experienced a rise of anti-Asian racism at the interpersonal level, but also institutionally, right? There was a report about how the kinds of punitive approaches to adherence to COVID restrictions have targeted disproportionately Black, Indigenous, and other marginalized communities, fining, policing, etc. And also, these kinds of ideas have also permeated, whether we recognize it or not, the kinds of health promotion messaging that we see encouraging people to protect themselves in terms of COVID. And this is one egregious example that I hope would make clear what I'm talking about. Right, so this is an image, and I think Sami Rumbua for alerting me to this, is an image of health messaging from LA County, Los Angeles, right? And if you look and read and look at the image, we need to pay attention to who is figured as doing the right thing and who is figured in this image as not doing the right thing and therefore threatening the vitality and the health of the broader community, right? So deliberate decisions about images like this, we need to pay attention to the kinds of subtext that they release. Okay. My theorizing on the relationship between race, health, and nation building owes quite a lot to social theorists that think about nation building both as a biopolitical project, as a project of giving life, making live, but also as a necropolitical project, a project that allows people to be abandoned and to be killed in order for those that need to be protected to be able to live, right? And there I'm drawing on Michelle Foucault, Shilin Bembe, and the communities of scholars that have taken up their ideas, particularly critical race theorists. Renissa Mawani is one of the folks that I've drawn on to help understand the relationship between race, health, and nation building. For Renissa Mawani, health is quote, important and uncontentious imperative of nation formation. Safeguarding the health of its citizens is one of the primary functions of the nation state, guarding it against threats. And we might think about that militaristically in terms of border control, but there are also overlaps and homologies when it comes to the provision of health and healthcare. This is premised partly on the state's will to know and to classify. And here we might think about state functions such as the collection of demographic data, censuses, and what those are for, right? And those are partly, the knowledge basis for the state to enact practices and policies that will support the longevity of the nation state itself and its citizens, right? So, which is to say that it is part and parcel of the will to govern, okay? Health, according to Mawani, is a kind of technology of governance. It's one that is constituted or constitutive of national borders and racial boundaries. Okay? And here public health gets to, we see, takes on the function that we would sometimes ascribe to border control, to immigration policies in terms of adjudicating who is a citizen and who isn't, who gets to come in and to stay out, based on the idea that it is important to protect the vitality of the nation state. I'm gonna skip this part. Renisa Mawani is the next speaker, as AD mentioned earlier. So I just wanted to plug her talk as well. I've also been very much influenced by Alison Bashford's work on health, partly as a practice of definition and a categorization, particularly of ideas around purity and risk, and the ascription of these categories onto bodies, communities, and spaces. Here, the definitional and classificatory politics of threat being from, quote, unknown people and unknown places, and the state's capacity and desire and will to regulate circulation, movement of people and matter. What Alison Bashford wants us to think about here are the homologies or the kind of overlap, shared histories between health and militaristic discourses, right? Pure ideas around purity are certainly, and wellness are certainly public health concerns, but they are also concerns of national nation building projects. She points to the crossover between military and health language and the ideas around immunity, resistance, invasion, and skin. And in the same work, she talks about how ideas around the body's skin and the nation's borders as kind of the definition, the boundary between the self and other, how that gets to be, that's one way to think about the kind of shared concerns of health and nation building projects. And finally, before I dive more fully into a couple of examples and case studies, I want to invoke the work of Shireen Razak in her 2008 book, where she builds on her previous work on race thinking and state racisms. And here, part of what I want to spotlight is Shireen Razak's definition of race thinking following Hannah Arendt as, quote, a structure of thought that divides up the world between the deserving and the undeserving according to lines of descent. When race thinking becomes policy, in other words, when, and I quote, it unites with bureaucracy, it becomes less an individual attitude and becomes more fully an organizing principle that underpins state action. Right? And so this longish quote from Razak I want to read, partly because it encapsulates in relatively a few number of sentences what I meant by nation building as both a biopolitical and necropolitical project. And I quote here from Shireen Razak, captured in the phrase, they are not like us, and also necessarily in the idea that they must be killed so that we can live. Race thinking becomes embedded in law and bureaucracy. Violence against the racialized other comes to be understood as necessary in order for civilization to flourish, something the state must do to preserve itself. And here it is key, I hope, for us to pay attention to the fact that the state's will to preserve itself requires that it defines who belongs as part of itself, right? And so the kind of eviction of racialized others from the definition of who must be cared for, right, is very much related to who gets to be abandoned, who gets to be excluded, who gets to be named or killed. And I want to think about how this has taken root or become material partly in and through examples and policies that are both local and national. I want to start with Chinatown as a geography of racialization. This is an image of one of several racist attacks on Chinatown and Chinese communities more broadly locally. And part of what I want to focus here is on Chinatown as an idea, as a racial idea. Right? And I turn to this example partly to get us to pay close attention, not only to the idea that Chinatown is an ethnic enclave, that ethnic communities, in this case Chinese communities, choose to create for themselves. That is part of the picture. But here I'm drawing on the work of Kay Anderson, her book from 1991, and this publication from 1987, that thinks of Chinatown as an idea with remarkable force and materiality. And it's an idea that has justified the practices of powerful institutions. Right, so what is Chinatown? How is it constituted? What does it have to do with the relationship between race, health, and nation building? Part of what I want to spotlight is what Nayan Shaw, writing about Chinatown, not in Vancouver, but in San Francisco, as being produced through the ways that description turns to policy, through the force of race and health as forms of scientific knowledge. So in Shaw's book, Contagious Divides, he talks about the ways that city officials, as experts, as governors of cities, how they are able to mobilize their powers, particularly powers of investigation, designation, and punishment, to construct racialized threats and to place those threats onto particular bodies and communities, right? And particularly Shaw spotlights the equation of Chinatown and illness, right? The kind of circulating ideas that are also found in the historical record in the Vancouver context of Chinatown as a menacing space. It's a source of the plague, it's a cesspool, it's the origin of disease and illness, right? And so here, Chinatown comes to be conflated with Chinese people, and the space is understood and reproduced as one that is characterized by filth and disease. In the Vancouver context, we see these ideas becoming formalized through the actions of state agents. Here, I have a long quote from the Royal Commission on Chinese and Japanese Immigration from 1902, and talking about the ways that Chinatown becomes the site through which racialized anxieties about the viability of, in that time, in the turn of like the 1900s, late 1800s, the anxiety around the viability of Vancouver as an emergent white settler society that is threatened by the presence of racialized others here. And so this long quote gives us a sense of that historical status of Chinese communities as outsiders. They're a community within our community, but separate and apart. They are within but not of our body politic, right? So the outsider status, but also their complete difference, and their complete difference in irreconcilability with white settler society through the language of health, right? Health behaviors, health practices, health beliefs. We see in the idea that they have habitual practices of overcrowding, that they disregard sanitation law, that they are menace to our health, right? So health is a key plank of the othering and racialization and eviction from the emergent city of Chinese communities. And not only that, it also takes on other forms in the ways that they do not understand as not being able to conform to norms around home life, school life, religion, right? And the idea that this complete difference makes their presence bad for the rest of the community. So we see this as well in terms of the circulation of images of Chinese difference in emergent settler colonial Vancouver. This is a political cartoon called The Unanswerable Argument. In terms of form, you can see that it is one that relies on juxtaposition as a rhetorical device, right? The juxtaposition of the so-called typical Vancouver white working man and the 2,000 Chinese at the bottom, right? And here, racial difference comes to be figured and differentiation comes to be figured through differences in domesticity. We have the single family home versus a warren. And for those of you who do not know what a warren is, it is the den of rabbits, right? And so there's an animalization process happening here that differentiates from the typicality of the domesticity of the Vancouver white working. Health is also crucial, whereas in the top image, we see a wholesome and healthy home. At the bottom, we see images of drugs, filth, smoke, etc. We also see differences in masculinity. We have the father, the image here of the father, I guess, coming home from work, greeting his daughter, right? Also figured bigger on the upper right-hand panel, versus a bachelor, right? One without family, right? Which is also partly about heteronormativity, right? Whereas the single family headed by a father, the nuclear family is typical of the Vancouver white working man. We see what Judy Wu calls compulsory deviance in terms of heteronormativity, right? The top person, the white working man, is a worker, whereas at the bottom is the representation of Chinese folks as indolent, as lazy, as not working. Right? And then there's also ideas around nature. The animalism, as I mentioned, is also perhaps contrasted to the kind of manicured front lawn, a tamed kind of nature in the case of the image on the right, on the top. Right? Now, what does this have to do with nation building? Right? Ideas such as these give force, give rhetorical support to what ended up becoming official policies and practices of both the municipality and the nation state. On the left image, we see a cartoon from 1907 that calls for opening the borders of British Columbia to white immigration. We see that it's closing to Oriental people, right? The gates is BC immigration policy, and we see similar representations of kind of the animalistic monstrous mass of Orientals on the right being guarded by Lady Britannia, right? And we see the worker with a modern ship compared to the junk at the end, at the right, right? And so these kinds of juxtaposition. So here we see violence of representation becoming part of the discourse on policymaking, underpinning it. And we also should make a connection to interpersonal violence and kind of group societal violence against Asian communities in the emergent city. The image on the right is an image of boarded up buildings, damaged storefronts at Carroll and Pender that arose, that were the effect of the 1907 anti-Asian riots that targeted Chinatown and Japantown, that was spearheaded by unions, trade unions who represented white workers who understood the presence of Asian communities as threatening their capacity to be workers. And I'll talk about that a bit more. Before I move on, I want to shout out Project 1907, which is a local initiative that makes connections to contemporary activisms and community organizing and issues faced by Asian diaspora communities locally to 1907, the date of the anti-Asian riots that are pictured in the image to the right. Now, how else did this transform into official state practice? I want to rely here on examples from Kay Anderson to talk about how in the city of Vancouver, Chinatown was not just the effect of Chinese communities wanting to be together, but a segregationist policy enacted by the city's governance structures, including and especially its health arm. Mawani, again, in writing in 2012, talks about the ways that the enactment and enforcement of municipal bylaws were key to the confinement of Chinese residents in Vancouver to several city blocks. The much lauded, at least now, celebrated Chinatown, but also one that still very clearly causes a lot of anxiety. Okay. Kay Anderson, in this book, talks about the racial construction of Chinese folks as threats and how that transformed into the designation of Chinatown as a health problem that needed municipal governance and the wielding of state powers, right? So she gives the example of in the mid-1890s, Chinatown became something that is of concern to the medical health officer of Vancouver, one that made it one of the things that was particularly paid attention to, along with water quality, along with sewage, along with slaughterhouses, along with pig ranches. And so if we think about the ways that objectification, dehumanization takes place when in this kind of juxtaposition, then hopefully we see also how race and health come to be collapsed. Race and disease come to be collapsed in this practice of Chinatown becoming constructed as a problem. What are some other forms of municipal racial regulation that Kay Anderson gives? Here are some more examples. In 1893, a local alderman created a bylaw the city passed that restricted where Chinese, well, laundries more broadly, at the time Chinese laundries were prevalent, where they can be located. So this is a clear spatial segregation policy that designated the only places where this is allowed and where it isn't allowed, right? DuPont Street, Columbia, Carroll, Hastings, these are some of the boundaries that were imagined to be where Chinese people are to be put in their place, both metaphorically and literally. In 1896, a boarding house bylaw that was just passed that year enabled the city, in the name of the health and well-being of Vancouver, to destroy dwellings in what was, emergent Chinatown at the time, right? The housing bylaw came to be a sanitary regulation, right? And buildings that did not conform because they were filthy cesspools were destroyed. And interestingly, DuPont Street was explicitly excluded from the new public sewer system that was built at that time. And so it became a kind of circulatory, like a circular logic, right? Exclusion from infrastructure, making them unhealthy, and the unhealthiness comes to be that which is used to destroy dwellings. Right? In the 1900s, there were also early 1900s, targeted laws mandating vaccinations. There were restrictions on operations on Sundays, and there were preventions on open air drying, which targeted laundries specifically that were owned by Chinese business folk at the time. So the examples that I've given, the mob violence, right, of the 1907 anti-Asian riots also worked in tandem with the legal and policy controls that these examples of local regulations came to be enacted in the name of regulating the health and well-being of Vancouver as an emergent settler colonial city by designating Chinese communities as a threat to that vitality. This is not just, of course, a Vancouver phenomenon. We might think more broadly about other kinds of regulations, the Chinese head tax, the Chinese Exclusion Act of 1885, the Chinese Exclusion Act of 1923, which the 1923 one was almost a complete ban on Chinese immigration to Canada. Right? We might think about this in the context of the border control that I also mentioned earlier, about how regulations such as these were imagined partly to support the futurity of settler colonial Canada and Vancouver, right, which meant the displacement or the exclusion from admissibility of racialized, in this case, Chinese communities. The Opium Act of 1908 is often not mentioned as part of the suite of national regulations, but the idea of the drug-addicted Chinese subject as needing regulation, according to Henry Yu, also became, quote, one of the vehicles for organizing Asian exclusion for targeting Chinese as immoral, right? And if we look at the image again from earlier, the pipe is as a central object in the representation of Chinese. We'll see that again. This was not just a Canadian example, it's one that was transnational. The 1907 riots were part of a Pacific Coast set of riots, including one from Bellingham. This is a newspaper from Bellingham, also in 1907, that targeted Bellingham's so-called Hindu communities, figured in the bottom right corner as Orientals, right? We also see this in the case of San Francisco. And here we see leprosy, smallpox, malaria as emerging from Chinatown on the left, right? So, and on the other side in 1899, the bubonic plague outbreak, right? And the destruction of buildings that were contaminated accidentally spread to most of Chinatown, right? So there's also the kind of violence, the razing to the ground of these communities, in part because they are understood to be the source of ill health and thus threatening, in the case of San Francisco, in the case of Vancouver, right, the public health of these emergent cities. Let's look at another example of a cartoon. And I'm realizing that it's 1:42. So I will try and wrap up relatively soon. But here we see again a cartoon from much earlier, 1878, as opposed to 1907 from the earlier cartoon. This is an American publication called Puck, and the cartoonist is someone named Kepler. We see a similar mobilization of juxtaposition as a rhetorical and representational device. side by side, and the differences in caption. On the left, it says why they can live in 40 cents a day, on 40 cents a day. On the right, and they can't. We see similar ideas around the nuclear family, the wholesome home, God bless our home on the top above the door here. We see the overcrowded, improperly domestic life of Chinese communities on the left, mostly men, so they are also not in conformance with the nuclear family ideal, right? But beyond that, we also see ideas of ill health, of filth, of the eating of rats here. That might contrast with the cat as a pet, different relationships to animals and nature. We see the pipe here, right? And we see on the right the futurity of the nuclear white family in the case of the children, which is conspicuously absent on the left, right? The captions are captions that attempt to mobilize workers, right, who are, and particularly workers constituted as white men, who are being asked to see Chinese communities as a threat to their capacity to be workers, to be fathers, to be husbands, to be providers, right? And so this is also, it extends some of the conversation earlier about the 1907 Vancouver cartoon, right? And part of what we see here is that these suite of representations of Chinese deviants are circulatory, like they move about other cities from other, like cities learn from other cities in terms of the use of rhetoric, the use of images, the use of representations, right? So the pot versus the teapot is another part here. What is missing in this conversation is what Judy Tsu-Shun Wu calls compulsory racialized deviance. And the word compulsory is critical here because part of what Wu is gesturing to is the fact that Chinese communities were explicitly excluded by design, by law, by policy from accessing nuclear family through restrictions on immigrations, financial restrictions on their capacity to reunite with their families, right? The designation, the segregation of these communities from the rest of the city through the kinds of municipal decisions, for example, right? That we talked about earlier, right? So instead, these ideas about the filthy, dangerous Chinese subject, right, gets to be naturalized, right? And part of what Wu wants us to see is that this is an effect of policy. Okay, I will very quickly, I'm going to talk about the fact that, you know, in the case of Dupont Street being excluded from the sewage system, right? The exclusion from public infrastructures and spaces that are meant to support the health and vitality of the settler population, right, is also another way that health is mobilized as a way of racializing and excluding racialized populations. So Stanley Park was created in 1887 to promote, according to Mawani, again, the Britishness of British Columbia. And as a green space and infrastructure of leisure, it was meant to enable the, quote, moral, physical, and imperial advancement of the city and its citizens. Right? Stanley Park was created around the time when there was this idea that natural spaces in the city are required because the industrialization has threatened the health of the community, and natural spaces are meant to cleanse the air, right? And therefore support the health of the community. Now, erasure was key to making Stanley Park as we know it, right? So Sean Courage in Inventing Stanley Park talks about the depopulation of Woy Woy and Stanley Park, where there were indigenous settlements, through the colonial introduction of disease and smallpox, right? So emptying so-called Stanley Park through introduction of disease, but also through law, And here I draw on Mawani, who talked about the way that the city of Vancouver and the Attorney General of Canada initiated legal action to displace people who were living in Stanley Park, right? And in the legal proceedings, they were constructed as a menace, partly because they were squatters and, quote, they lived like Indians, right? The idea being that they were improperly domestic, right? And they were therefore a threat to the image of Stanley Park and its function as supporting the broader health of the community. Maybe I will just conclude because it's 1:48, my goodness, by talking about, or at least pointing to the fact that some of these ideas from, early 1900s, late 1800s, are ideas that we see having contemporary life, right? In terms of who is understood as risky, right? Who needs to be quarantined or boycotted, right? In terms of who and whose name and whose health policies must be enacted, right? Which spaces and communities are targeted by violence, but also in policy and law. Right, and then I want to end again by invoking the C19 Response Coalition to see, foreground the fact that communities who are racialized are not passive. They invoke their own agency, put it to use to create kind of ethno-specific, for us, by us kinds of resources in order to support their own health in the absence of such support broadly from the state, right? So I also want to recognize that as part of this picture as well. Because this is recorded, for those of you who are interested in the kinds of sources that I've drawn on, here's a list. I won't go over them. You can pause the recording to review them later on. And then finally, I want to thank you for spending an hour or so with me to talk about this, and to thank many people, Amanda Wan for the research assistance, the folks who organized this, the 1 Hour EBC team for inviting me, and for support, Julia Chai for moderating, the EIO, and particularly the IBPOC Connections group for the work that you do, for organizing the series, the ACE initiative, the Asian Canadian Community Engagement Initiative at UBC, as well as all of you again for listening to me today. Thank you very much.
Thank you, John Paul. I'm just going to move us over to our question and answer period.
Right. Thank you so much, Dr. CATUNGAL, for the incredibly insightful discussion into both the historical and current colonialism and the structural racism that still very much exists within our healthcare systems and the policies that shape our society and the norms. I'm going to hop in on the questions, and just a reminder to the audience, if you have any questions to submit, go on to slido.com, and our code is EXLEI13. Great, so I'll hop into the first question that we see here, which is, should we think about inclusion as the opposite of marginalization, or is the relationship between them more complex?
Very good question. It's the latter. Inclusion can also be a form of racialization. Okay? It's interesting that the regulations that I talked about that aim to target Chinese communities as health threats took place after the Chinese community's labor in, say, the railroad was already completed, right? And so there are ways that, racialized labor is foundational to the making of Canada as a nation. The CPR, the Canadian Pacific Railway, was one that was imagined as the kind of spine that will unite the Pacific coast of British Columbia to Central and Eastern Canada, right? It's literally a territorial expansion project of the Canadian nation state. And Chinese labor was particularly key to the making of that infrastructure, right? And symbolic, both symbolic and material, right? And so in a sense, there was a place for them, right, in the role of worker, but as possible settlers who are seen to be threatening, right, the whiteness of the white settler society, right? It is in these ideas and through their designation as threats to public health, right, that their exclusion then took place. So that's one way, right, is to think about actually there is, the people of color who are marginalized have been understood as useful. There's a utility to them, but only if they maintain or remain in that role, right? So that's one way. We might invoke multiculturalism here, and here I'm drawing on analyses of multiculturalism by folks like Samara Tabani, right, and others who talk about multiculturalism not as the project of the Canadian nation state embracing, including communities of color in the fold of the nation state. That's certainly one way to think about it, but also as a way of disciplining them. Disciplining them in terms of using them as a means to construct Canada as, an enlightened nation state, one that has diversity as its key plank, differentiating it from other places, right? So there's also a kind of utility being made there, but also analyses of multiculturalism have also spotlighted the fact that multiculturalism is often enacted through a kind of song and dance and food way, as opposed to actually unpacking racism and racialization as it is embedded, right, in the structures of society, baked into society. So their inclusion does not always guarantee marginalization. I hope that answers, at least gets us some distance into answering this question. It's not a complete answer though.
Great, thank you so much.
Thank you.
The next question that we have is, what do you suggest are ways to systematically address race thinking in both everyday society and at higher decision-making tables, i.e. the governments and policymakers?
It's a huge question. One is we need to admit, we need to analyze the existence of race thinking as central to the way that we narrate ourselves, right? As a city, as a nation state. We need to look at how it shapes everything, right? And to divest ourselves of the idea that the way things are the way that they will always be, right? So an openness to change, but change that is open to other ideas about being together, right? Perhaps one aligned with Indigenous sovereignty, for example, as opposed to the Canadian nation state, right? One that has a more complicated idea of, diversity that is not the kind of shallow multiculturalism that is often celebrated, right? It also means paying attention to the analysis and experiences of folks who are marginalized by policy and law and governments, right? And because the kind of activism is a kind of knowledge production. It spotlights what is wrong, and communities of color have for a long time, Indigenous communities, Black communities, been naming these issues. But the response is not always in parallel with the fact that, these communities are already naming these issues. So they can speak, but are we listening, I guess is what I'm saying.
Great, thank you. The next question that we have is, what is the difference between race and racism? Race is argued to be a social construct, not an objective being. How can we understand the complexities of race?
It's a huge question, and one that I hope we got a little bit of an answer to in the slides. racism is, race is, often understood to be a natural quality of a person. This is my race, it's a property, it's a trait. And racism is one that tells us that has political and social manifestations, underpinnings, force, right? And so the social construction of this thing we call race, right, is part of the practice of racism. And here, hopefully, the kind of link between race thinking about categories of people when it comes to be translated into policy, when law gets enacted in the name of safeguarding these differentiations, then we can see how racism is then materialized. Again, a big question. Hopefully that gets us a little bit close to an answer.
Great, thank you so much. The next question that we have is from Fiona, and she asks, wonderful presentation. Do you see parallels with how Nova Scotia's Black community of Africville was treated? Demolished, seen as a public health threat?
Yes, absolutely. The slides that I breezed through was about Africville, actually, in Halifax, Nova Scotia. So Africville, for those of you who do not know, was a historic Black community in Halifax. It was created in the mid 1800s by Black communities, some of whom moved to Halifax from the United States. I'm leaning here on the work of Jennifer Nelson in her 2008 book, Raising Africville. In her analysis, she diagnoses 3 steps in the history of Africville being demolished, I think in the 1980s. I'll just go back to my slides here. The first is that illness was induced in Africville. So Africville, like Chinatown, was the product of municipal decisions. In 1850, in the 1850s, while the rest of Halifax was getting infrastructure to support their health, right? Sewage, roads, running water, garbage collection. Residents of Africville were not included in that, right? Kind of like the Chinatown example of DuPont being represented as a cesspool, but that was actually an effect of municipal decisions to exclude them from infrastructure, right? So that's one way of inducing illness. Another way is that unwanted land uses, LULUs, locally unwanted land uses, were situated in or near Africville. This is a form of environmental racism where slaughterhouses, fertilizers, oil storage, human waste disposal kits, infectious disease hospitals, right? These illness-inducing land uses, other communities in Halifax didn't want them. And so they were situated near or in Africa, right? So no infrastructure, right? So exclusion from health supporting systems, the foisting of environmentally racist decisions on the community, right? An open pit dump was located near Africville in 1950, right? So that's one stage. You induce illness. You represent and make Africville unhealthy, right? The second thing is what Jennifer Nelson calls euthanasia, right? We take them out of their misery, right? And that was done partly through forcible relocation, right? Your community is too unhealthy, right? And therefore we need to rescue you from your own suffering, right? And so Africville was, residents were displaced, moved to other areas of the city, and the community was bulldozed. And this was partly related to the fact that the city of Halifax wanted to turn that area into an industrial zone, right? And then the third is burial, according to Jennifer Nelson. And this is, in the burial is the forgetting of the history of environmental racism in Africa, right? So the commemoration of the presence historically of the community there without necessarily naming the violence of municipal decisions that made African residents ill, right? And to that led to their displacement in the name of safeguarding their own well-being. The huge parallels, lots and lots of them. And I see here, like down, also a question around Hogan's Alley. One thing that I will say is that the decision to displace Hogan's Alley residents in the local Black communities near, just south of Chinatown, was partly, is one that was also premised on the idea that this is for the greater good of the city. Right? And so the greater good is defined as excluding by necessity the Black communities. Right? And so in that case, the infrastructure was a highway. It was about imagining the future of transportation and mobility in the emergent city, which led to the racialized sacrificing of a vibrant and important space, neighborhood for local Black communities. So this idea, we often think about public health as being about the greater good, right? But who gets to be part of that greater good, right, is part of the logic that I hope I have been able to describe, right, as key to the practices that I talk about here.
Great, thank you so much. I guess the next question that we have is, has there been any historical or current resistance or action taken by racialized communities in Canada?
There have always been, and there always will be. And so I shouted out the C19 Coalition, I shouted out Project 1907 as some contemporary examples of resistance and action, where racialized communities recognize that they cannot rely necessarily on the formal powers to look after their needs, right? And so, so these are certainly contemporary examples. And historical examples might include, people creating support systems for themselves. I want to shout out David Ng in his work. He's in Love Intersections, for those of you who know, but he's working with the LIM Association, like a family association in Chinatown, to talk about the history of the LIM Association. And associations such as these we can think about as kind of for us, by us, like ethno-specific forms of creating support and infrastructure, supportive kinds of spaces where they otherwise don't exist elsewhere. And certainly in the formal, in the state-sanctioned ways that we talked about earlier. So that's another example. Let's think methodologically. How might we get at historical examples? We need to think about how communities gather in spite of or because of, right, their experiences of exclusion, right? So these are not just people coming together, they're coming together because of certain issues, right? And there are a lot more. Community organizing is very much about this, right? As a form of action and resistance, often through a critique of the inadequacy of formal responses.
All right, thank you so much, JP. We only have time for one more question, so this will be our last one. So our last question comes to, are there spaces for interdisciplinary thinking in public health administration to come up with more equitable and holistic approaches to health?
Absolutely. I think this is already happening, right? Part of what I hope to have impressed upon you is that the humanities and the social sciences, and certainly the humanities, what is paying attention to a cartoon, to editorial cartoons do to allow us to make better, more socially just decisions around healthcare, right? Hopefully, what we are able to see from the examples that I've given in the analysis that I've drawn on and presented to you, right, is that these kinds of humanistic analysis of representations, right, of boundary making practices, of ideas around who deserves to live and who deserves to be abandoned, right? These questions are certainly questions that should be part and parcel of the way that we think about and govern health, right? And in many ways, this interdisciplinary thinking we already see in terms of the community organizing of these marginalized folks who powerfully mobilize art, right? Who powerfully mobilize counter representations as a means to get their message across to folks who are doing the work of designing, implementing public health decisions and practices, right? So these kinds of artistic, creative, really interdisciplinary ways of analysis and thinking, right, tell us that scientific knowledge is not the only knowledge that could be powerful in terms of shaping public health. That indeed historically, right, the kinds of cartoons, these representations of historical representations of people as filthy, as irredeemably other, right, irreconcilable to white settler society, right, these representational practices were key planks of decisions, municipal and state decisions, right, that were partly, but not solely, done in and through institutions and agents of public health, right? So let's open up who gets to be on the table. Let's open up what kinds of knowledges should be in place, right, and welcome. These are the kinds of, when I think interdisciplinarity, that's partly what I'm thinking, right, is the diversity, the different epistemologies, the different methods, the different angles that different practitioners take. Biomedicine is one of them, an important one, but it is not the only one. And we have a lot to learn from those who come from the arts and the humanities.
Right. Thank you so much, JP.
Thank you.
Is unfortunately all the time that we have today. I'm going to pass it on to Aideen to wrap up today.
Thank you, John Paul and Julia. Just at closing, I just want to remind people where they'll find more details about our final lecture on July 30th. You'll find it at our 1 Hour GBC website. Today's lecture is being recorded. You will find it very soon on our Extended Learning YouTube channel. If you have any questions at all, and I know unfortunately you did not get through all the questions, so if you want to send those questions and you'd like a follow-up, please do send them to us at info.exl@ubc.ca. We'd be happy to pass them on to John Paul and Julia. And so now just very much thank you, John Paul, for explaining race thinking of the past, and so helping us and how it define policies, and so help us all recognize it today. Julia, thank you for managing the Q&A so professionally. It is such an important aspect of this 1 hour. And of course, finally, thank you to all our participants for being here today, for your great questions and making us part of your Monday. Take care, everybody. Stay safe and see you soon.
Thanks, everyone.